Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The International Physical Activity Questionnaire assesses physical activity levels across various domains, including work, transportation, domestic tasks, and leisure time. It measures the frequency, duration, and intensity of physical activities performed by adults. The main purpose is to provide standardized data on physical activity patterns for epidemiological studies and clinical assessments. This instrument aids in identifying sedentary behavior and risks associated with cardiovascular diseases, obesity, diabetes mellitus, and other non-communicable diseases. The questionnaire facilitates public health surveillance and evaluation of interventions aimed at increasing physical activity and improving population health outcomes. The International Physical Activity Questionnaire is indicated for adult populations aged 15 to 69 years across diverse demographic and geographic settings. It is particularly useful for patients without severe cognitive impairments or mobility restrictions that would prevent reliable self-reporting. The questionnaire is commonly employed in clinical contexts, requiring assessment of physical activity levels to inform cardiovascular risk stratification, diabetes management, obesity treatment, and rehabilitation programs. It facilitates standardized evaluation of walking, moderate, and vigorous activity intensity over the previous 7 days, supporting treatment planning and outcome monitoring in both primary care and epidemiological research environments. The International Physical Activity Questionnaire consists of 9 items assessing physical activity over the previous 7 days. The questionnaire includes questions on the frequency and duration of vigorous intensity activity, moderate intensity activity, walking, and sitting time. Each item requires the respondent to report the number of days and the average time per day spent on the specific activity. Responses are recorded in days and minutes, allowing for quantification of total physical activity in minutes per week. To administer, the healthcare professional instructs the individual to recall all physical activities lasting at least 10 minutes across various domains such as work, transport, domestic tasks, and leisure. Data should be entered into a standardized scoring sheet that calculates total physical activity in metabolic equivalent minutes per week. Interpretation involves categorizing physical activity levels into low, moderate, or high based on established cutoff points. Low activity corresponds to less than 600 metabolic equivalent minutes per week. Moderate activity ranges from 600 to 3,000 metabolic equivalent minutes per week, often including at least 5 days of walking or moderate activity. High activity exceeds 3,000 metabolic equivalent minutes per week, typically reflecting 7 days of vigorous activity or an equivalent combination. Sitting time is considered separately to assess sedentary behavior, but does not influence the physical activity category. The results provide objective measures to guide clinical decision-making and physical activity recommendations. Sensitivity refers to the ability of a test to correctly identify individuals who perform adequate physical activity, representing true positives. Specificity denotes the test's capacity to correctly identify individuals who are insufficiently active, representing true negatives. For the International Physical Activity Questionnaire, sensitivity values vary depending on the population and reference standard, but generally range between 75% and 85%, indicating that it correctly identifies the majority of active individuals. Specificity values are more variable, often reported between 50% and 70%, reflecting moderate accuracy in identifying inactive individuals. For example, in a clinical setting where the International Physical Activity Questionnaire is used to screen for physical inactivity, a sensitivity of 80% would mean that 80 out of 100 active patients are correctly classified. Conversely, a specificity of 60% implies that 60 out of 100 inactive patients are accurately detected, while 40 may be misclassified as active. These performance metrics underscore the questionnaires' moderate reliability in distinguishing activity levels, but also highlight the potential for misclassification. The International Physical Activity Questionnaire was developed in the late 1990s through a collaborative effort led by the World Health Organization and the Centers for Disease Control and Prevention to provide a standardized instrument for measuring physical activity across diverse populations. Validation studies have consistently demonstrated moderate to strong reliability, with intra-class correlation coefficients typically ranging from 0.6 to 0.9 across various language adaptations. Criterion validity assessed against accelerometer data and doubly labeled water methods reported correlation coefficients between 0.3 and 0.5, reflecting acceptable convergent validity for self-reported physical activity measures. Research conducted by Craig and colleagues in 2003, involving over 20,000 adults from 15 countries, established the questionnaires' cross-cultural applicability and measurement consistency. Subsequent investigations have examined test-retest reliability, yielding values around 0.8, and construct validity through associations with fitness and health-related biomarkers. These empirical findings underpin the widespread use of the International Physical Activity Questionnaire in epidemiological studies and public health surveillance worldwide. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.